Hey everybody, today I'm going to review Chapter 26, Understanding Strategic Relationships Between Healthcare Delivery Systems, Finance, and Reimbursement. This chapter starts out by defining the three areas, include the definitions, and how it fits into the overall system. The book then describes the various strategic relationships that are involved, intertwined, etc. What is a healthcare delivery system? This is actually where you provide patient care, whether it's ER, OR, clinics, urgent cares, doctor's office, rehabs, nursing homes, etc. There's a lot to a healthcare system. I'm going to flip the page. Top of 318 talks about who is part of a successful health system that functions properly. Needs the 6 following elements: adequate funding, trained health workers, of course, managed infrastructure, reliable supply of medicine technologies, evidence-based policies, strong health plans. Who are the stakeholders in a delivery system? So Figure 26.1 does an excellent job at that. Insurance providers, government providers, policymakers, overseers, the pharmaceutical, medical device industry, educators, professional organization, health industry suppliers. It's greatly influenced. All of these, on the next page, it talks about investors, caregivers, and consumers too. These are the stakeholders in the healthcare delivery system. So it's not just doctors, nurses, hospitals. It is so much involved in our healthcare system. Lots of opportunity for employment, different job roles, managerial, executive-wise. It's a great system. Let me rephrase that. It's a challenging system with great job potential. Healthcare is a huge industry in the United States. It's actually a huge industry across the globe. Just some other countries don't have all these access to all the different stakeholders. But anyway, that's for a whole other course to talk about. Defining the area of healthcare finance. So what are the responsibilities associated with finance in healthcare? You have to plan, control, organize, and make decisions. Your book gives you examples. You may hear some construction in the background. All is well. Just a little construction going on at the home front. I'm going to keep going. What are the duties associated with finance? So essentially, we have to have successful management of the finances. Someone has to plan well, control expenses and reimbursement well, direct and decision make together. Your book does a good job at describing that. Some organizations, depending on the size, will have, smaller ones will just have managers. Larger ones will have treasurers in charge of the finance. And then major medical systems, whether it's hospitals, outpatient centers, cancer treatment centers, they're going to have chief financial officers. So many different levels. Your book continues defining the area of healthcare reimbursement, what are the responsibilities and what are the duties. They're listed there. Those are listed separately. Be familiar with those. Page 321, strategic relationship between healthcare delivery and system finance. The next page is the strategic relationship between finance and reimbursement. So they're all related. But let me go back to the relationship between healthcare delivery system and finance. There's a cause and effect relationship with this relationship. Cause and effect with this relationship, yes. Figure 26.2 shows some of that. Please let me know if you have any questions about that. There's different steps listed. The strategic analysis relationship within the system. I know you hear that construction. Medical service data is recorded in EHRs. Okay, so bottom of page 323, strategic relationship between finance and reimbursement. You would think the book even references like a one-way street, like it is what it is, but it's not that simple. So if the reimbursement part fails, then any healthcare system limits its cash flow. And it's one thing to be talking about like a small dental office losing $20,000 of cash flow versus, which that's a lot of money for a small dental office, but in comparison, a major hospital system losing $2 trillion or $2 billion worth of cash flow. So even if small or large, we don't want to lose any money just for failure for reimbursement. That's why there's so many entities set up for reimbursement. Okay, page 325, third-party reimbursement and government expenditures. Just another strategic relationship. So reliance on third-party reimbursement, this is the largest reimbursement pool, if you will, for healthcare systems. It's the private insurance companies, people who have insurance. Then we have government, then we have things like TRICARE for our military, etc. Reimbursement methods have evolved, and they're ever evolving. Some of these numbers on the bottom of this page, 325, the dates are old or older and have changed significantly, but you can still get the impact, see the difference in the numbers. So page 327, a new focus. This is where we're moving forward in healthcare finance. So we have to move forward, because sometimes what worked even 5 years ago doesn't work today, and that's okay. And especially what worked 10, 20 years ago is not going to serve the healthcare system today, because it's ever changing. The bottom of 327, it talks about what we used to do, sustainable growth rate, SGR. This is the old way of doing things, but what it was, it had an unintended consequence. So basically, Medicare was like, hey, as a physician, you can only charge this amount of money per patient visit. Well, what happened is physicians started limiting how many Medicare patients they saw. And understandably so, because you're cutting the rate of the doctor and telling them how much they can charge. Well, as soon as you start losing money, if you have 90% of your patients are Medicare, then you're not going to make the money like you would from the private sector. There's a lot, I'm not saying I agree with it, I'm just explaining it, but there's a lot to that with the reimbursement regarding limits. So what we're doing is the healthcare finance is moving forward. We're moving to value-based reimbursement. So page 328, it talks about new performance payment reimbursement. So for example, one of the current rules, I should say, is if a patient leaves our emergency room and comes back within 24, 48 hours, I can't remember the number, I think it's 48 hours, with the same symptom or the same chief complaint, we're not reimbursed. So in other words, we should have sent that patient out better, more informed, well prepared to take care of whatever they had going on. That's just one example. Another example is if somebody comes in for, I'm going to say, a car wreck, and then they acquire a pressure sore or urinary tract infection or something while they're in the hospital, insurance companies, Medicaid, Medicare, will not pay us back for that, because that is stuff that should have been prevented. So that's just another example of value-based and where we're heading. Okay, that pretty much sums up Chapter 26. Conclusion, CMS is attempting to make the nation's healthcare finance system based on value-based payments, etc. In your spare time, if you would like to, it's pretty intriguing to see what other countries do regarding their own healthcare finance. Many countries, people get healthcare for free. There's challenges with that. Many countries, you are self-pay for your entire healthcare. There is no such thing as health insurance. I can see very easily how quickly somebody could really go bankrupt with that idea too. But anyway, it's ever evolving. When you all graduate and you're out in the field and you come up with a spectacular idea at how to fix things, then you have to share that and use that, and that's how changes come about. So please ask me if you have any questions. Thanks.